Now, nobody else so far this afternoon has mentioned the plans for a ban on LGB conversion therapy, and I'd like to say that I support that ban, although I do think the evidence for how much it's a contemporary problem is questionable, but it was certainly a very serious problem in the past. I'm just going to develop my argument before I give way. However, I'm concerned that honourable members are coming under pressure to support a ban on what's described as trans conversion therapy, which ignores the interim report of the CAS review and the testimonies of Tavistock Clinic whistleblowers and detransitioners. Now, there's an exponential rise in the number of girls seeking to transition, Mr Deputy Speaker, and many of these girls will be same-sex attracted, and it's important that this possibility and other explanations for gender dysphoria, such as autism, are able to be explored in a respectful way with a qualified therapist before young women embark on a road to medicalisation. Experiencing gender dysphoria in childhood or puberty doesn't necessarily mean that you are trans. Thousands of adult lesbians and gay men like myself will know this to be true. And I think it's really important that honourable members understand that trans-inclusive means assuming all children who say that they are the opposite sex are transgender, and it also means insisting they don't need psychotherapy if they say they don't want it. And Hilary Cass, former president of the Royal College of Paediatrics and Child Health, has been commissioned to report on NHS gender identity services for children. And her interim report, published a couple of months ago, has provided worrying information about the lack of normal clinical standards being applied to children with gender distress. More work needs to be done, but the interim results show a high proportion of cared-for children, those with autism or experience of abuse, and children who would be likely to grow up as lesbian or gay, presenting for gender services. So I'm advocating for evidence-based policy making. Let's wait for the outcome of the CAS report, and let's not be influenced by those who want to criminalise therapists who simply want to do their job and act in their patients' best interests. We urgently need proper informed debate in public and in Parliament, and this must centre on the well-being of children and young people.